I would like to ask Dr. Brian this question here before we proceed. That is, how do people get into any form of addiction?
Thank you, Sita. So just before I answer, I just wanted to share my disclaimer, which is, I'm sure you've seen the institutions I work for, and whatever I say today is my own personal opinion. It's not, I'm not representing those institutions. So just wanted to say that. Secondly, I want to actually talk about, first of all, how we define addictions, because that's the foundation of our discussion today. And, people use the word addictions very broadly, and that does not necessarily correlate with what in clinical medicine we call addiction. So I'll just give you four broad areas. So the DSM-5, which is the Diagnostic Statistical Manual in America, which is kind of the Bible of psychiatric disorders, has 11 symptoms that fall into 4 categories. So I won't go through all the symptoms, but I'll tell you the 4 categories, which will sound familiar because Sita, you just mentioned some of those. One is impaired control. The second is social problems. The third is risky use in terms of your personal health or even the settings. And the fourth is physical dependence. So as you mentioned, the brain changes. So the receptors in the brain change. And so the person actually physically becomes dependent to the substance. And so the severity depends on the number of symptoms. For example, if you have 2 to 3, it's called mild. 4 to 5 is called moderate. 6+ is called severe substance use disorder, which in the real world is called addiction. So as you can see, it's not a yes or no, it's a range. We don't really know why people develop addictions, because it's a multifactorial thing. There's no single cause. But what we do know is that those people who have addictions or substance use or any other addictions have a very high co-occurrence of other psychiatric disorders like depression, anxiety, personality disorders. And there are many theories. Of course, no single theory applies. All of them apply. So one is that there's a genetic basis. So some very elegant studies have been done in families where there's a lot of alcoholism, and found that the incidence of alcohol use or misuse is higher. When it's never, people always think, he is addicted, she's addicted. And yes, eventually it's the individual, but it's never only an individual. It always affects the system. It affects the couple, it affects the family, it affects the community, it affects the workplace. So intervention has to always be more than just the individual. Whereas if you all know, I'm sure you all know, because you have observed, whether it's in India or in Dubai, or is the person tends to get labeled as the alcoholic, and everybody's attention is towards the person, saying, you need to do this, you need to do that, you need to do this.
True.
And it's not as simple as that, because whatever they're doing has some potential cause in the family, and sometimes it has also a potential implication for them getting better.
Dr. Brian, I'm sorry again to interrupt you here. I just have this doubt. I'm not sure if any of our guests also have this doubt, but do you think that some of the reasons why people get addicted is because it is very, very similar to that of the reasons that someone who is prone to commit or tempted to commit suicide is? Do you think there are very, very similar variables which makes either of the two people in either of the categories take the step that they do?
That's a great question. So there are relationships, and there's overlap and not overlap, right? I'll tell you the overlap. The overlap is when you look at addictions and you look at suicide, there is a high degree of co-occurrence of psychiatric conditions like depression, anxiety, personality disorder. So that is the overlap. And there's also not overlap because, even though the incidence of suicidal thoughts and suicidal behavior might be increased, it's not, it is not necessarily the sole problem of, people who use. Also not to forget that, when people use, especially when they use kind of in risky conditions, often people can die without being suicidal. We call that non-suicidal deliberate harm, which is like, for example, overdose. Often the people who are overdosing and dying are not actually committing suicide in an overt way, but the point it remains that there is a higher risk of psychiatric conditions in this group of people, and so therefore suicide is an increased risk, and you always have to be mindful of it. So
okay, thank you, Dr. Brian. I think we'll come back to you a little later with the next question as well. Thank you. So I think from Dr. Brian and what he has told us or conveyed to us, it is true that addictions do tend to run in families, yet but not all members of an affected family are necessarily prone to addictions. Now, some of the possible reasons here, in fact, I think from my perspective, as a layman perspective, Dr. Brian, I would say the first one would be probably the lack of a healthy, positive support system in the person's life. And the second one could be growing up with members who are addicts of some form for some reason or in some area, either substance or activity, and also being abused as a child. The third one is being abused as a child. And of course, the fourth one is also about how exposed a person is to extraordinary stress. Now, I think from all these few reasons I have mentioned, I think one common factor is there. A lot of the time, people may be prone to getting addicted because of loneliness, because of the belief that they do not have someone in their life whom they can turn to.